I'm Margaret Curtis. I'm a pediatrician at Central Maine Pediatrics. There are two groups of food allergies. One is the more serious kind, which can sometimes lead to something called anaphylaxis, and that's the one people probably hear about the most. Those symptoms usually start within minutes to up to 2 hours after eating a food, and those symptoms in kids are most likely a rash, sometimes hives, and vomiting. They can also have drooling, wheezing, or difficulty breathing. And obviously, if any of those things happen, you should either call us right away, or if you're really worried, even take your child to the emergency room. Another group of symptoms of food allergy tend to be more chronic and start days to weeks after starting a new food and last for days or weeks. And those are things like rash, some irritation around the mouth, diarrhea, tummy upset, that kind of thing. Sometimes we see poor growth in kids who have severe food allergies that last a long time, but those are symptoms that can wait a little longer and you can talk about with your doctor at a visit. So if you see your child with hives, vomiting, difficulty breathing, drooling, or really not seeming like themselves, being kind of pale, low energy, then either call us right away or take your child to the emergency room, depending on how serious you think it is. If it's more of a chronic issue with rash, fussiness, diarrhea, then call us and make an appointment, in the next few days to a week. So we used to say that we should wait to introduce food to babies that might cause allergies until they were older. And then we did some more research and realized we probably weren't giving very good advice. So our best advice now is to start pretty early with babies. So your first food should still be simple foods like fruits or vegetables or baby cereals. And then you can start introducing more foods that could potentially cause allergies like eggs, peanut butter, yogurt. Cow's milk is a little hard to digest for most babies, so we usually wait until about a year. So you can start with those foods. When you think they're ready, just put a little bit on a spoon or even on their skin at first, let them kind of play with it, put it in their mouth. They don't need to eat a lot of it, but introducing those very small amounts early on, between 4 and 6 months, seems to lower allergy rates later on. Now, it can be different with a baby who has a history of eczema, or if there's a family history of either food allergy or eczema. So you should talk to your doctor about that. If it's a severe history, we might send them to see the allergist first, or we might introduce those foods in a very careful, controlled way.